Hi, I'm Travis. I'm going to be your nurse today. Can I have your name and date of birth, please?
Yes, that's Nikki, March 8th, 1995.
Perfect. Let me check your wristband really quick. Excellent. I've established 2 forms of identification. I make sure that I had all my equipment prepared and ready. I reviewed the patient's chart prior to coming in. I made sure privacy was intact, the curtains drawn, the doors shut. Do you have any spiritual or cultural beliefs I need to be aware of? Perfect. I'm going to do a full head-to-toe assessment of you to make sure every part of you is okay. Is that something that you'll let me do?
Yeah.
Perfect. Are you having any pain right now?
No.
Okay, on a scale of 0 to 10, 0 being no pain, 10 being the worst pain of your life, what's your pain at right now?
0.
Perfect. The patient's free of pain. Just looking over the patient, she doesn't have any mobility devices around her, which lets me know that her mobility is intact. Her skin looks free of any lesions or redness or edema from what I can see. Her speech pattern is congruent her speech pattern is unslurred. She has good rapport with me already. She's able to answer my questions. She knows where she is, why she's here. Do you know where you are?
Yeah, I'm in the hospital.
Do you know why you're here?
I'm here to get an assessment.
Perfect. What day of the week is it?
Tuesday.
And the year?
2020.
Perfect. She's alert and oriented ×4. She appears her stated age, her mood, her affect is good. She's very responsive, alert, and free of pain at this moment, so I'm going to move forward. I'm going to do an inspection of your head, eyes, ears, nose, throat, and mouth. Is that okay?
Mm-hmm.
Okay, I'm just going to kind of look over you really quick, all right? Your hair looks like it has good texture and body, full. Your scalp is free of lesions, dryness, and any kind of bleeding or cracking that I can see. Her face, her nose looks symmetrical, and there seems to be no, can you tilt your head back for me? There's no deviation with her septum. Her nares look dry and pink. Her lips look dry. You can look down. Her trachea that I could tell was a midline. I didn't see any signs of edema. Her eyes are, her sclera are white and clear. Can you pull down your eyelid for me on both sides? Perfect, the other side. Her conjunctiva have good pink color. Everything seems even and symmetrical. Can you open your mouth for me? Her hard and, you lift your tongue? Her hard and soft palate are pink and free of any kind of lesions or abrasions. A little bit more, sorry. Her gums look healthy and intact, her teeth look healthy and intact, and her buccal mucosa looks healthy and intact. All have good color, no lesions or bleeding or swelling. Her ears look free of drainage. Thank you, that helps. Her ears look free of drainage and have good color, no swelling or trauma on either side. Both are free of drainage, including her nose does not have any kind of drainage. So at this point, I'm going to clean my equipment. Are you okay if I palpate over you a little bit? Make sure there's no... I'm going to don gloves at this point, try to. Gloves are not being cooperative. Oh man. Okay. I'm going to go over your head, okay? Let me know. I'm going to palpate your head, make sure there's no kind of tenderness or swelling. There's nothing that I can feel. Does this hurt?
No.
Okay, I don't feel any masses. Look at me. I'm going to feel your eyes here. Is there any pain when I do this?
No.
Can you open your mouth? Close it. Go ahead and open it. Close it. Perfect. Her TMJ looks to be free of any kind of crepitus or swelling. It felt smooth. She was able to push against resistance with ease. Again, free of cracking. Can you look up for me? I'm going to palpate your trachea, okay? Can you swallow for me? Perfect. Checking the carotid pulse now. Both sides are even and 2+. Her thyroid was free of any kind of masses, as were her lymph nodes. Her trachea was in line. I didn't feel any kind of deviation on her trachea. I felt no signs of edema or cracking, and there was no pain associated with that. Perfect. Okay. Okay, I'm going to do an eye exam on you really quick, okay? So look right at me and just stare straight ahead and don't move, okay? Okay, just follow the pen for me, okay? Don't move your head, just follow the pen. Perfect. So the pupils were equal, round, reactive to light, and they both accommodated. Go ahead and follow the pen for me. Don't move your head, just follow with your eyes, okay? Perfect. Excellent. Her 6 cardinal fields of gaze are intact. Do me a favor, take your finger, plug one nose, and inhale and exhale. Do the same thing with the other nose. Perfect. Nasal patency is good. Everything seems to be perfectly in order with her head, eyes, ears, nose, mouth, and neck. I'm going to move down to your upper extremities, okay? So hold up, just lay your arms flat for me. Okay. From a visual standpoint, her muscle bulk looks good. I see no signs of lesions or edema. Can you flip them over for me? Same with the anterior and posterior side are both free of lesions, edema, and redness. Do you mind if I palpate your arms? Okay, let me know if you feel any kind of tenderness or any kind of pain, okay? Noting the bony protuberances here. I don't feel any kind of indifference. Cap refill is less than 3 seconds on both sides. Flip your hands over for me. Radial pulses are balanced and 2+ on both sides. Oh, just hold still, you're fine. Thank you. Brachial pulses are balanced and 2+ on both sides. Hold your fingers together for me. See no signs of clubbing in her nails. Hold your hands out. Look intact. Perfect. Go ahead and squeeze my fingers with both hands. Excellent. Hold your hands out like this. Push against me. Push. Perfect. Pull. Excellent. Can you do, let me see you do this. Okay, now put your hands down. Close your eyes. Tell me what hand I'm touching.
My right one. My left one.
Perfect. Okay. Nails all look intact. Was there any pain when I did that? Perfect. Okay. I'm going to have you sit up for me, okay? Okay, now hold your arms out to the side. Go above your head. Down. Flex. Extend. Do this with your wrist for me. Opposite end. Perfect. Okay. I'm now going to assess your anterior thorax, okay? Can you put your hair behind your, thank you so much. Excellent, okay. Just from a visual standpoint, I see that there's no accessory muscle use for breathing. I see good chest rise and fall. Her sternum is right in the, is midline. Everything seems very symmetrical. I see no discoloration, no edema, no lesions. I'm going to auscultate in 8 different areas on your chest, okay, just to make sure you're breathing okay. Starting at the supraclavicular notch. Just do a full inhale, full exhale, okay? Breathe normal. no adventitious breath sounds. While I'm doing this, tilt your head back for me. I'm going to check your carotid for any sign of bruise, okay? Hold your breath for me. I heard no bruise in the carotid area. The anterior thorax had no adventitious breath sounds, no crackles, no wheezes. Respiration seemed normal and unlabored. Go ahead and lay back a little bit for me. I'm just going to palpate. Let me know if you feel any pain, okay?
Okay.
You feel any pain when I do that? Nothing? Perfect. There was no pain. I didn't hear any crackles or any crepitus at all when I was palpating the anterior thorax. I'm going to now auscultate for cardiac sounds, okay? In the 5 areas, starting with the aortic, just breathe normal, okay? One full inhale, full exhale. Starting at the second intercostal space for the aortic valve, the second intercostal space for the pulmonic valve, the third intercostal space for the Erb's point, the fourth intercostal space for the tricuspid, and the fifth intercostal space for the mitral valve and the point of maximal impulse. Perfect. I'm going to hold this for 10 seconds, okay? It'd normally be a minute, but for the purpose of the video, it's going to be 10 seconds. Perfect. Apical pulse was 66 beats per minute. It's within normal range for my patient. I'm going to go back up one more time, okay? Starting with the mitral valve, I'm going up with the bell. The tricuspid valve at the fourth intercostal space. Erb's point, the third intercostal space. Pulmonic valve at the second intercostal space. And the aortic valve at the second intercostal space. Perfect. I heard no sign of murmurs or thrills. I'm going to palpate one more time, okay? Let me know if you feel any pain. Any pain? Okay. I can actually palpate and feel the point of maximal impulse on my patient at the fifth intercostal space. Okay, I'm going to have you flip around for me, okay? Make sure they can see. Perfect. Okay, just from looking at my patient from the side, I can see that she has a good anterior to posterior transverse diameter of 1:2 ratio. No sign of barrel chest. No use of accessory muscles for breathing. Are you comfortable enough? Okay. I can see that her scapula is symmetrical to her vertebrae. Everything seems intact and normal. I see no signs of redness, edema, or lesion. I'm now going to auscultate. Forgot to note that when I was auscultating the anterior thorax, I was starting from the scapula, the supraclavicular point down to the sixth rib. On the posterior thorax, I'm going to be working from the top of the scapula and going down to the 10th rib, kind of in a C shape. All right, just breathe normally, okay? were no adventitious breath sounds. I heard no crackling or wheezing or any labored breathing. I'm now going to palpate your back. Okay, can you kind of turn a little bit to the left, or just a little bit? Right there, perfect. Is there any pain when I do this? Take a deep breath for me. One more. Good. When I palpated, I could feel a good inspiration and good expiration. Full on both, unlabored, no signs of crepitus or labored breathing to note. I'm going to have you turn around for me and lay on your back, if you don't mind. Yeah, feel free to get comfortable. Let me know if I can make you more comfortable, okay? Are you warm enough? Perfect, okay. Let me make sure they can see. Okay. Now going to assess the abdomen in the four quadrants, the right lower, the right upper, and left lower. I can see that the umbilicus is midline. I see the contour is flat. Everything seems symmetrical. I see no signs of redness or edema. Have you had any pain with your abdomen at all? Any kind of, nothing to note? Okay, perfect. I'm now gonna oscillate the four quadrants for 10 seconds in each quadrant. Just breathe normally, okay? The patient was absent of any hypoactive or hyperactive bowel sounds. I'm now going to lightly palpate, okay? Let me know if you feel any pain. Is there any pain when I do that? Perfect. I'm going to have you sit back up really quick for a second. I forgot something. Look at me, smile, frown, puff your cheeks out for me. Perfect. Stick your tongue out, back and forth with it. Perfect. Open your mouth and say ah.
Ah.
Perfect. I already established with Perla that her pupils were equal, round, reactive to light, and both accommodated, which meant cranial nerve 2 and 3 were intact. My patient's facial nerves were 7. Cranial nerve 7 was intact because she was able to smile, frown, and puff her cheeks out. And her cranial nerves 9, 10, and 12 were all 3 intact when I just assessed her with her tongue. Anyway, okay, can you lay back flat for me? Sorry, I forgot to note those. Okay, I'm now going to assess your lower extremities, okay? I can tell that she has good, her skin has good circulation. I don't see any sign of lesions, edema, or redness. Do you have any pain with your lower extremities? Okay, do you mind if I palpate them? Perfect. Let me know if you feel any pain, okay? Noting the bony protuberances. Is there any pain when I do this?
No.
Good. Her muscle bulk's good. Her skin temperature is good on both. I forgot to do that on the upper extremities too. Noting that her skin is dry and has good temperature on her upper and lower extremities. Cap refills less than 3 seconds on her lower extremities. I'm going to check her dorsalis pedal pulses. and they are equal in balance in 2 plus. I'm going to assess her posterior tibialis pulses. And they are both balanced and 2 plus. Now push. I want you to push against my feet like a gas pedal. Now bring them back to you. Move your ankles around for me. Perfect. Close your eyes for me. Which foot am I touching?
Right one.
Which foot am I touching?
Left one.
Perfect. Can you lift one leg up, the other one? Go out with them. In. Bend your knees up. Perfect. She has full range of motion in her upper and lower extremities. When I have you sit up, I'm going to have you do your neck. I forgot to do that one too. But you can do it really quick if you want to. I'm sorry, I keep forgetting stuff here. So up, down, to the sides, look left and right. She has full range of motion in her neck. I'm going to have you lay flat a little bit flatter. Are you still comfortable?
Yeah.
Perfect. If you could roll over for me, I'm going to take a look at the posterior side of your lower extremities, okay? Sorry, I keep having to have you run back on me here. It's my fault. Okay, I'm going to palpate your posterior lower extremities, okay? Let me know if you feel any pain or tenderness.
Okay.
Any pain or tenderness?
No.
Perfect. Her skin is dry, free of any lesions or edema on her both sides. Muscle bulk looks good. You can lay on your back for me. Done 2 neurologic exams on my patient. She was doing, she passed both. Do you have any questions for me?